Weight management is a journey, not something that happens overnight, as we just heard. So we're going to continue the conversation with Dr. Eric Wilson, a bariatric surgeon with the Cone Health Bariatric Surgery Program and member of the Cone Health medical and dental staff. So you just saw the story there where Dr. Wilson was talking about it. Let's kind of go back to like square one here. Let's talk about the health risks of not maintaining a healthy weight.
Yes, when someone suffers from obesity, they're at increased risk for developing high blood pressure, joint or mobility concerns, diabetes, sleep apnea, and even certain cancers.
All right, and just recently we learned of like Lisa Marie Presley's death and that she died from complications from bariatric surgery. So what can you tell us about the health risks that are related to this kind of weight loss surgery?
Yes, with any weight loss surgery or any abdominal surgery, there can be complications and bowel obstructions can occur. It's exceedingly rare to have a bowel obstruction after bariatric surgery, and even rarer to pass away from a bowel obstruction complication. I think the take-home message is that if you've had any type of major abdominal surgery and are having abdominal pain, then you should be evaluated. The likelihood of dying after having bariatric surgery is less than 1 in 1,000. And so we've been doing bariatric surgery at Cone Health for close to 20 years, and our mortality rates are less than national average.
Okay, and so the surgery, of course, is just one of the options. It's probably not the first option that people would go to. So let's talk healthy eating and exercise, so we don't even get to that option. We know that both of those, healthy eating and exercise, are important for weight management. But what are some things that you think can help us get on the right track?
Well, I think one of the take-home things to remember is any weight gain didn't happen overnight. So I think setting realistic expectations that any weight loss will take some time. And so I think working on your food choices first, starting with maybe perhaps lean proteins and non-starchy vegetables and complex carbohydrates. And then once you're consistent with that, then incorporating some type of physical activity, such as walking, or if you have mobility challenges, then maybe some type of water therapy.
All right, so it's kind of like baby steps, right? You can't just go cold turkey and expect everything to change. You got to change a little bit at a time. And definitely people want to see results quick. So what should we realistically look for when we start thinking about someone who's starting a health journey like that?
Well, I think, one of the first things that most people will experience once they start eating and changing their food habits might actually just how they feel. They may not see an immediate change in the scale, but they may feel more rested and have better sleep by just simply changing their food around.
Okay. Now we've heard lots of weight loss medications, that are becoming very popular. Some people see that they can drop pounds quickly. Is this a sustainable or recommended weight management tool for like long-term health benefits?
Well, I think one of the things to remember is that obesity is a disease, just like high blood pressure or diabetes, and we now have some very effective medications out of the market to help treat obesity in addition to surgery. But the takeaway message with these new medications like semaglutide is that they're meant to be long-term. Generally, once the patient stops these medications, about 2/3 of patients will experience some weight regain. So these medications are meant to be more chronic and long-term.
So taking them the rest of your life kind of thing?
Potentially. Right now, that's what the studies are showing that we have completed to date.
So what do you do when healthy eating and exercise just isn't working for you?
Well, unfortunately, a lot of research has shown us that only about 20% of patients who are obese are able to achieve and maintain long-term weight loss. But with bariatric surgery, you have a higher chance of long-term success maintaining a healthy weight.
All right, it's not for everybody, but when is it good for someone to consider the weight loss surgery?
Well, I think if you have demonstrated efforts at weight loss in the past, and then from an insurance perspective and medical perspective, you have to have a BMI or a body mass index greater than 40, or a BMI greater than 35 with some health-related matters due to obesity, such as sleep apnea, high blood pressure, reflux, or mobility issues.
Okay, and so if someone does get the bariatric surgery, what are some of the health benefits that those kinds of patients experience due to the surgery?
Well, most patients who complete bariatric surgery or have bariatric surgery will experience a decrease or an improvement in high blood pressure, improvement in diabetes, improvement in sleep apnea, reflux and even decrease the chance of developing certain cancers.
All right, and I know we've gone over some of the highlights of what people can expect with the surgery and that kind of thing, but are there some things with the weight loss surgery that maybe we haven't thought about?
Well, like with anything in the medical field, it is a process, it is a journey, and patients realize that we have to make sure that you're medically safe to undergo this procedure, as well as that you have the proper education and tools in order to be successful long term. And at Cone Health, our entire bariatric team is here to ensure your long-term success.
All right, well, kind of piggybacking on that, Cone Health offers free at-home and in-person classes so that you at home can learn more about the surgical options for weight loss. So let's talk about how we get involved with that. How do we register?
Right. We offer both in-person live seminars once or twice a month, as well as free home seminars that you can watch online. You can go to conehealth.com/weight loss and register for one of the in-person seminars that we hold both in Greensboro and in the Burlington area, or register for the online seminar that you can watch at any time.
And we have been talking about bariatric surgery. That's been like the main thing, but Cone Health has non-surgical options for weight loss to help people manage their weight. Let's talk a little bit about those as well.
We do have a comprehensive nutritional management program, so if you're interested in talking with one of the Cone Health dietitians, that can certainly be arranged. And then with Cone Health's new Sagewell Fitness at Medical Center in Greensboro, you can talk to your provider about giving you a prescription for a 2-week workout with one of their exercise specialists as another option.
I love the prescription. It's not a drug. It's actually to work out and to learn some things and get yourself kind of like on the right track.
It's a great facility. They have instructors there that will take you through cardio machines, strength training, and they have a fantastic water therapy program as well.
Right, and it takes that whole thing away of I don't know how to use the machine and I don't want to be in there by myself and all that. All right, some final thoughts about managing weight for a long-term well-being.
I think you should just get started in any way that you feel is right for you right now, whether or not that's talking with one of the dietitians or exercise program at Sagewell, or if you're interested in learning about bariatric surgery and just wanting to get healthier, start now. And we're here to help you at Cone Health.
And I know it is start now, which is always good. Do they need to start with their primary care provider before they get to a specialist?
Not necessarily. The seminars are meant for anybody who just would like some generic information, because at the seminars we introduce the concept of bariatric surgery and talk about the different procedures as well as the process and some of the lifestyle changes that you would have to make after having surgery.